Hello, and welcome to the EMJ GOLD podcast, brought to you by EMJ, your #1 open access destination for HCPs and pharma globally. So it's just me today, I'm afraid, but while Isabel is away sunning it up in Cornwall, I'm here to share with you another great conversation in today's episode. So recently, I had the pleasure of talking to Dr Joana Reis, who is the Medical Affairs Breast Lead for Radiology at Bayer, and that's a role that she actually kicked off 2025 with. Before this, she was the Medical Affairs Lead for Digital Radiology at the company, where she developed strategies focusing on AI applications in imaging, much more. You'll hear all about it in the episode. Before joining the company, Joana worked as a Senior Consultant Breast Radiologist in Oslo, Norway, where she gained some really valuable experience in both diagnostic and screening settings. Now, Joana is so committed to transforming healthcare by aligning innovation with patient-centric outcomes, and that is something that we do touch on during our conversation, including other things like what first sparked her interest in radiology, what some of the most significant challenges in breast imaging are today, and much more. But I do think that's enough of an intro from me. Let's get into the conversation.
Hi, Joanna. Lovely to meet you. How are you doing today?
Hi, Joyce. It's really a pleasure to meet you as well. I'm fine. I'm doing fine. Thank you. How are you doing?
Yeah, lovely, actually. I was going to say it's really sunny here, but suddenly the weather's turned, as it does in London every single day, and now it's freezing cold, and my office refuses to turn off the aircon, so I'm wrapped up here.
By the way, thank you so much for having me. It's a pleasure to be here.
Yeah, I'm really looking forward to speaking to you, actually, because today is all about women's health and radiology, which is a topic that I'm very much interested in myself. Obviously, I know it interests you as well, because you've dedicated your entire career to it, so, which does lead me on quite well into my first question, actually. I'd love to know what first sparked your interest in radiology and in particular breast imaging. But maybe before we get into that, could you explain your role and what you do to our audience?
Oh, sure. So I'm a breast radiologist. My background, currently I'm working at Bayer as a global medical affairs breast imaging solution lead.
Mm-hmm. Wonderful. Yeah. So I'd love to, obviously you've done quite a lot in your career already that's led you to this point. What first inspired that spark that got you into radiology and in particular, breast imaging?
Thank you for the question. So my interest in radiology developed quite late, actually. So during the final year of my medical degree, until then, I had focused more on clinical rotation and hadn't had much exposure to radiology in practice, to be completely honest. But during my last year, I had the opportunity to work more closely with imaging in the multidisciplinary setting. And I began to really appreciate how central radiology is to not only for diagnosis, for treatment, and for treatment planning as well. So that experience sparked my curiosity and ultimately led me to pursue this path. Regarding the second part of your questions, regarding breast radiology, that was during my third year of residency when in Norway, in the north of Norway, in the city called Bodø. So I did the rotation in breast imaging, and that's when I truly fell in love with the women's health. I realized the profound impact it could have, not only on patient, but as well on the caregivers and family. And after that experience, I was certain that breast radiology was the path I wanted to pursue. And that's when I decided as well to also invest in the PhD focus on breast MRI in local advanced breast cancer patients treated with neoadjuvant endocrine treatments. So it is indeed a fascinating field. So where we can have a positive impact on patients' outcomes, and also through research and application of novel technology, including AI. So I really believe radiology contributes heavily to medical innovation.
For sure, absolutely. Yeah, I mean, I love your interest in women's health, especially because, it's such, I still can't believe that, we're 50% of the population, but still women's health research has gone so overlooked, underfunded. So it's great to see that, voices like yours and others in the industry are really pushing for that. It's, wonderful to see.
Now, if I can just, sorry to interrupt you. So I really do believe a lot has already been done, for sure, regarding breast imaging, but we still have a lot to do. So as we just mentioned, so breast cancer is the second most common cancer overall, and the most common cancer in women, so impacting around 2 million worldwide each year. So it's still a devastating disease.
Yeah, for sure. Hopefully we can see as the years go by some of those numbers decreasing there. So moving on to my second question, I know that you made the decision to move from clinical practice over to industry side. Some might see that as, you've turned to the dark side, but I'd love to know what motivated that transition to this sort of wider scale work that you've been doing.
Yeah, so the decision to move from clinical practice to industry to Bayer coincide with the final stage of my PhD. So at that point, I felt I needed a change, both professional and personally. So after so many years balancing clinical work and research, I was looking for a new environment where I could continue to have an impact, but in a different way. So I joined Bayer. It was initial for a digital position, where I had a chance to work closely with AI tools, AI algorithms, and contribute to a highly innovative field. It was an exciting opportunity to apply my clinical background to digital transformation and to explore how technology can enhance diagnostics and patient workflows. Then about 7 months ago, so actually January 1st, I transitioned to this position, so to the breast imaging solution, as I mentioned in the beginning. And this move brought me back to my core passion, so allowed me to continue my clinical expertise, my academic backgrounds, and now industry experience to help advance care in this space. What I liked and what I still like about Bayer, it is pioneering role in radiology. Its strong footprint in medical imaging, including collaborations with key thought leaders across radiology, across the globe, including not only breast, but cardiac, liver, CNS. So altogether, it's I'm very happy.
I can imagine. Yeah, it's great technology. What would you say has been your proudest moment over these past 7 months in your new role?
I think we have an amazing team across collaboration, cross-functional teams. And another thing that I've been very happy is working with societies. So I have been the opportunity not only with the talk leaders, but as well with the European Society of Breast Imaging, that is called OZOBI, with the American Society of Breast Imaging, SBI. So this is, and the other educational organizations has brought it to working together, learn from them, and bringing to the best that we can to our patients.
Absolutely. Collaboration is so important. It's so important.
Yeah, exactly. So I really believe that together, us at Bayer, with all our collaborators and partners, we are committed to support and fight against breast cancer and driving advances in early detection.
Completely. That's a wonderful way to put it, I would say. So I'd love to know, going on to a bit of a harder question, I suppose. What do you see as the most significant challenges that we're seeing in breast imaging today, particularly, in improving things like early diagnosis or reducing variability in imaging?
Oh, thank you for the question. It's a great and difficult question. So I will say, to put it in one word, I will say underdiagnosis. So underdiagnosis of breast cancer has been a key challenge in women with certain risk factors, especially with dense breast tissue, or not special, but just to give an example. So mammography is the gold standard for breast cancer screening, and there are several national population-based screening programs in many European countries, which is great. However, for women with dense breasts, for example, there is mounting scientific evidence that standard mammography might not be enough. So breast density is important to mention. There is a risk factor, a real risk factor for development of breast cancer, and also decreases the sensitivity of the mammography for screening because cancers are being masked. And if I can mention, so this is why recently published regulation by the United States FDA requires mammography facilities to notify, it is mandatory now to notify patients about the density of their breasts. So this is not happening in Europe so far, for example. And for women with dense breasts, supplemental screening options such as contrast-enhanced mammography or breast MRI can make a crucial difference, but they need to know about it. So in particular, breast MRI is increasing use as a supplemental screening tool for high-risk patients, and especially due to its high sensitivity, but patient needs to be aware. So to increase insight into the value of such supplemental screening tools, we at Bayer are supporting several studies by external institutions, such as two big trials, the DANCE-1 and the DANCE-2 from the Netherlands, and one that was the results were recently published, the BRIGHT study from UK, that the results showing the increased sensitivity of breast MRI and contrast-enhanced mammography. And if you can give me a chance just to add that another challenge besides the underdiagnosis is regarding the lack of public awareness. So in a recent study also conducted by Bayer to better understand the needs of human to be aware of breast screening, we found that more than 60%, so 60% of humans were unfamiliar with high breast density and as a breast cancer risk factor. So I would say we are moving in the right direction for sure, but there is still a lot to do, especially when it comes to making a more aware of what breast density means for their health and making sure they have access to the right screening at the right time and the options available.
Yeah, it's a hugely concerning thing. I mean, it's great to see, like you mentioned, those notifications that people in the US get. So it would be really important, I suppose, the value of education it's been hammered into us all for so long, but then how hopefully we can see harder to reach populations will be able to get those notifications, will be able to get more screening and education tools to help them with that as well.
Exactly.
Yeah. So you've touched on already your love for professional societies and your work with them. I would love to know what role you see societies playing in accelerating innovation in radiology. And, if you have any particular examples you'd like to pull out, I'd love to hear them.
I already mentioned two of them, the ones that we have been working closely, but I will say that breast imaging societies play a fundamental role. They play a fundamental role in accelerating innovation. So they serve as a trusted platforms that bridge not only scientific evidence, clinical practice, and policy. So they really help drive adoption of new technology by granting guidelines, educating clinicians, not only clinicians, as well as HCPs, healthcare professionals, and advocating for access, reimbursement, just to give some examples. So we work very close, once again, with OSOBI, so the European Society of Breast Imaging, and they have been instrumental in promoting the use of breast MRI. I can say that, for example, in 2019, they released a key recommendation supporting breast MRI screening for women with extremely dense breast based on evidence from the DANCE trial 1 from the Netherlands. And this was a very important step because although the imaging modality has been available, uptake was limited by lack of endorsement in guidelines. So their updated position in 2022 reaffirmed the value of breast MRI, helping to spark policy conversations in several European countries by pushing breast MRI into the spot for risk-adapted screening. This was from Europe. We can also have some examples over in the States. So the Society of Breast Imaging, the SBI, also plays a leading role. They have advocated, for example, annual screening starting at age 40. So they also help integrate innovative technology like artificial intelligence, contrast-enhanced mammography, abbreviated MRI protocol. So they have been fundamental for clinical discussions and educational platforms. So I will say that they support as well real-world evidence. So, and this real-world evidence, they are key tools when trying to demonstrate the clinical, the economic of this new technology. So, in short, they are true accelerators of both clinical confidence and system-level acceptance. So, very happy that we have this network and collaborations with them.
Yeah, absolutely. I think we could go on forever singing the praises of societies.
No,
They're
exactly.
hugely beneficial. They're amazing.
No doubt.
So you touched on, again, in that answer, AI. Obviously, it's a very hot topic across all of healthcare, but especially so in radiology. No surprise there. You've mentioned as well that it's something that you've worked with a lot before in your role, in the digital aspects of your role. So I'd love to see how you see AI shaping the future of breast imaging.
As you mentioned, I really believe that AI can be very important and play a key role in radiology and for breast imaging as well. And we are also indeed aware that radiology practice and radiology departments around the world are extremely under pressure. So it's time, as resource limitations, more administrative requirements, just to name a few challenges. So we can counter these with different measures. And I really think, in my personal opinion, that AI can really help. So AI applications are designed to support radiology in their increasingly demanding daily tasks. They hold promising to help tackle the growing workload. For example, AI can assist radiologists by quickly detecting abnormalities, by automating routine tasks, enhancing imaging quality assurance. And this will allow radiologists to focus on complex cases and reduce the pressure associated with high case volumes. Specifically for breast imaging, there are already several promising innovations and already many of them commercial available. AI algorithm can assist in both acquisition and interpretations of mammographic images. Can give you some examples. For analyzing both 2D and 3D mammograms, AI can quickly detect abnormalities, so thereby improving diagnostic accuracy. There are already density assessment solutions that simplify and standardize breast density reporting and stratifications and provide accurate and at the same time reliable results. And this once again will enable clinicians and radiologists to proactively implement personalized screening plans for, in this specific case, for human with dense breasts. Another examples. So AI can also streamline workflows by automating routine tasks such as measurements, such as reportings and generations. And of course, clinical evidence data generation is very important, but I can assure you now that there are already publications available. I can mention one that was published in 2020 in Nature that demonstrate that AI algorithm for mammography screening could reduce false positives. So I think for US was around 6% and for UK around 2% of false positives, and false negatives, the number was quite similar, around 10% of 2 to 3% for these two countries compared to human radiologists. So this indicates improved diagnostic accuracy, particularly for human with dense breasts. I cannot finish my answer without mentioning the Masai trial, so the large-scale Swedish studies published in the Lancet in 2023. So they also use an AI algorithm for mammography, and this AI algorithm was able to increase the breast cancer detection rate, so by around 20% compared to traditional methods. So also leading to a reduced number of diagnostic areas, in other words, of false positives. So these are improvements that I really believe that ultimately AI might enhance efficiency in clinical practice.
For sure. Yeah. Thank you for sharing all of that. I think, thankfully we've moved past the phase of, fear of AI. I think I remember there was a lot of speculation around, oh, it's going to take people's jobs, but I don't think everyone has concluded now, thankfully, that AI it's not going to replace radiologists. It's a tool that they can use to give them, as you've mentioned, accurate, standardized ways that will lessen their already way, way too high workloads.
Exactly. I would say that's not going to substitute us, but it's going to support us.
Yes.
So
100% agree with you there. So I've come on to my last question, and I'd love to, bring us back into the present. We've taken a look at the future. It might be far off, but we'll see. If you could change one thing today about the way that breast imaging is done or delivered to patients, what would that be?
Whoa. Just one thing.
It's a big one, sorry.
Yeah, this is a big question. But honestly, I don't know, for me, it would be to ensure fair, balanced access to effective screening and early diagnosis across all healthcare systems globally. So that means moving beyond one-size-fits-all approaches and adapting strategies to resources, infrastructure, and population's risks of each region. So if we divide it in high-income countries, we'll face underuse of proven tools like breast MRI in high-risk populations or in human with extremely dense breasts, often due to reimbursement, due to workforce capacity or awareness gaps. But on the other hand, if you are referring to low or middle income countries, the challenge, they are more fundamental. So limit access to mammography or any imaging at all. So in a fair, balanced world, every woman, regardless of where she lives, would benefit from early detection with the best tools available, tailored to her risk level and setting. So I think that alone could significantly reduce the global burden of breast cancer, both in terms of modality and the emotional, that is also very important, the emotional part and the financial cost to patients and healthcare systems. So if we can close the gap between what is possible and what is actual implemented, we can improve survival outcomes and reduce late-stage diagnosis and make a meaningful impact in both high resources and underserved settings.
Yeah, wonderfully put. I think it's, it's a very big gap to cover, as you've mentioned, but obviously it's a reachable one, it's an attainable one if we all, work together to close it.
Exactly, and think globally.
Think globally, not locally.
Exactly.
Wonderful. Oh, Joana, I think that brings us to the end of our conversation. Thank you so much for joining me today. It's been lovely to chat with you.
The pleasure was all mine.
It was such a delight talking to Joana. In particular, I really liked what she was saying around the importance of patient education for breast imaging. As she mentioned, the lack of public awareness is quite staggering, especially with regards to that 60% of women that are unaware of high breast density as a risk factor for breast cancer. It's, certainly an area where I hope to see some improvement. But with that, I do think we've come to the end of the episode. Thank you so much to Joana for joining me, and thank you to you at home, as ever, for listening. Do be sure to tune in next time for our season finale. It's not one to be missed, but until then, it's bye from me.